Yep.
Hello, I'm Dr. Reagan Wittek,
And I'm Kris Glassford.
and we're here today to chit-chat about urinary tract infections. About 50 to 60% of women develop symptoms of urinary tract infections over their lifetime. So the numbers are incredibly high, and we kind of wanted to talk a little bit about the symptoms, the treatment, how you test for it, and just educate you guys a little bit more on them.
What is a urinary tract infection?
A urinary tract infection, in very simple terms, is an infection in your bladder. The way the system works is your kidneys will form the urine. It'll travel down your ureters and into your bladder, and then you'll pass it out when you sit down and go to the bathroom through your urethra. The whole system, from your kidneys as it travels down the ureters, your bladder, until it comes out, is liquid that should be completely sterile. And what that means is free of any bacteria in it. When you get bacteria in the system, anywhere in the system, that's called a urinary tract infection.
What are some causes of UTIs?
The main cause of urinary tract infection is bacteria from your vagina region and your rectal region getting up into the urethra and then traveling up into the bladder. Women experience these way more than men, just because of the anatomy down there. And when you get bacteria in your bladder, when the bacteria multiplies and gets to a certain level, you will become symptomatic.
So what are the symptoms?
The three main symptoms of urinary tract infection is dysuria, which means painful urination; frequency, which means that commercial, gotta go, you gotta go to the bathroom. You have to, the second you feel it, you have to go right then. You don't have time to, tell your kids to give you a little second. You don't have time for anything. You have to go right then. So dysuria, frequency, and urgency. So, we just did the urgency. Frequency is you have to go all the time. Normally when you go 3 or 4 times a day, you're going 10 to 15 times a day.
Okay. How would I know for sure if I had a urinary tract infection?
Well, really, you shouldn't, other than maybe feeling pressure and thinking, oh, I need to go to the bathroom, you shouldn't have any of those other symptoms. Your brain will tell you need to go to the bathroom. You can leisurely go to the toilet and go to the bathroom without problems. So, and you shouldn't have pain when you urinate. So if you do have pain when you urinate, if you do feel pressure all the time that you're not used to feeling, if you do have frequency or the urgency, then you probably need to make sure you don't have a urinary tract infection.
Some fact or fictions.
Okay.
Things that I've heard that you can get a UTI or a urinary tract infection from.
Okay.
Like, one would be wiping from back to front when going to the bathroom.
When you poop, your stool is full of bacteria. So if you introduce that stool to the area where your urethra is, that will greatly increase your chance of having a urinary tract infection, because that bacteria will sit around that area, start to multiply, colonize or grow in the urethra, make it to the bladder. So that's actually fact.
Okay. What about not going to the bathroom after having intercourse?
Intercourse is one of the most common causes of a urinary tract infection. As I said multiple times, your vagina is full of normal bacteria. The male genital system is full of normal bacteria. So when you introduce the bacteria to the area and then don't have a way to clean it off, then it increases your chance greatly of having a urinary tract infection. So that is also fact.
What about certain sexual activities?
Well, same concept. The more that you introduce bacteria to the region, from whatever reason, the more you're going to have a urinary tract infection.
Okay. What do I do if I think I have a urinary tract infection?
You need to get in touch with your doctor. Also, this is a great use of urgent cares in the area, because they can test your urine. When you test your urine, they will test for a bunch of things that should not be present. You should not have blood in your urine in general. You should not have a complex compound called nitrites in your urine, because bacteria forms those nitrates. So when you urinate in a cup, the office can dip a little stick into that urination area, pull it out, and read and see if you have some things present that shouldn't be there. And that is the most common way to tell if you have a urinary tract infection or not.
Does cranberry juice really work?
Cranberry juice, interestingly enough, does have some properties that do help urinary tract infections. The way you have to use cranberry juice is if you have any inkling of the symptom, or you know you have a history, you need to start hydrating with it immediately, both with water and cranberry juice. The way that they think that cranberry juice truly does work is that the juice has a property in it that will allow the bacteria not to stick on the sidewalls of the bladder, and so will hopefully flush it out. But once you get to a certain point of number of bacteria in the urine, it's not going to make a difference at all. But if you can use it quickly enough that there's only a little bit of bacteria in there and you can start hydrating with it, that will flush it out. So that is actually fact, but once you are very symptomatic, it's not going to work. You need to get to a doctor.
When should I call my doctor?
The second that you still feel symptoms, you should try to head in that direction of being tested and treated within a good 24 to 48 hours. The reason being is that an infection in your bladder can then move up to your kidney, and a kidney infection is pretty severe. You can get a high fever from it, you can get nausea and vomiting from it, and so that will affect your daily life greatly versus just a urinary tract infection, which will stay confined in your bladder.
How does a physician treat a urinary tract infection?
A urinary tract infection is treated no other way than antibiotics. There's a couple antibiotics we try as first line that we just know treats the bacteria that normally causes urinary tract infections. And you can also send that urine to a lab and have them grow out the actual bacteria. And then the lab has a way to test to make sure that the bacteria that has grown out that is causing your symptoms is resistant or non-resistant to the antibiotics, so the antibiotic's going to work. And sometimes that'll be done, and that's called a culture, a urinary culture. So you'll sometimes hear the doctor say, well, I'm going to send this down for a culture and make sure we're treating you appropriately. Some people do that, some people don't. The symptoms of your urinary tract infection should go away within 3 days. So if you're on the correct antibiotic for your day 3 of that antibiotics, you should start feeling much better. And if you don't, then we as an office or physicians or nurses need to hear about that.
Okay. Once I have a urinary tract infection, does that mean that I'm particularly prone to getting them again?
That's a tough question. If you have a urinary tract infection because you wipe inappropriately or your hygiene is different, then yeah, you're going to get them if you don't change your behavior. But in general, or if you get it after sexual activity all the time, then you're going to get it every time after sexual activity. That's just the way your body's interpreting the bacteria that's getting caught down there. So there are people that are more prone to urinary tract infections, and they say you are prone to urinary tract infections if you have more than 4 or 5 a year.
Okay. If I get a UTI a lot, is there anything that I or my doctor could do?
Well, you can change your hygiene. Some good things are to wipe appropriately. Make sure that when you wipe from front to back, and you drop the toilet paper in the stool after you hit the rectal area. So the most common causes that I mentioned earlier of it are wiping and sexual intercourse. After you have intercourse, get up and go to the bathroom. That urine that comes out of your bladder after that will wash that area away. So wash that bacteria away. So that will decrease your chance of getting a urinary tract infection. So those are some good things that you can do on a daily basis or after you have intercourse to help decrease the amount of urinary tract infections. Don't hold your urine for very long times. If your bladder is getting extended and your urine is just sitting there, it'll give the bacteria time to multiply more than if you just emptied your bladder immediately. So there are some things you can do. Your doctor's office will key into people who are more common to have urinary tract infections, and they can do some things about it. Some of my patients get it every time after they have intercourse, so I put them on a prophylactic, which means before an infection antibiotic, every time after intercourse, and that will greatly decrease the amount. I talk to them about hygiene. We also have some patients that we know that get it all the time, and we know how they're treated appropriately. So if you form that relationship with your doctor, that will really help you. Are you done? Okay. A couple really fast that I wanted to mention about pregnancy and urinary tract infections. When you become pregnant, hormonally changes a big difference in your bladder and your urinary tract area. The first thing is that hormonally you do not pass urine as frequently. Your urethra isn't as active, and so you get a lot of stasis or sitting around of the urine in your bladder, urinary retention. Your bladder also is very persnickety. It doesn't like the fact that your uterus is growing and putting a lot of pressure on it, and so even sometimes when you sit to empty your bladder, you do not empty it all the way. And so you're more likely to get a urinary tract infection, and really a urinary tract infection without symptoms for a while when you're pregnant. And that's why it's important to kind of notice a change in your bladder and let the doctor know at your appointments. A kidney infection when you're pregnant can make you down and out for a good week, and so we really need to try to avoid that.